Hey everyone, and welcome back to Pass MA with Dani. If you're new here, my name's Dani. I am an allied health educator, and over the past several years, I have had the privilege of helping thousands of students prepare not only for, but to pass their CCMA certification exam. Before we jump into today's lesson, I just wanted to say thank you. I've been getting so many messages and comments from you guys asking if I could start teaching lessons here on YouTube instead of only just doing NHA review questions and exam prep videos. So I absolutely love this idea because I know everybody learns differently. And sometimes it's really helpful to really just kind of understand the material before jumping into practice questions. So I'm really excited to say that we're going to start adding full teaching lessons to the channel alongside of the reviews. So my basic goal is to help you not only pass the exam, but for also you guys to become confident and knowledgeable in your careers. So today's lesson is all about infection control, which is one of the most important topics that you guys are going to learn. We're going to cover the chain of infection, different types of pathogens, hand hygiene, PPE, medical versus surgical asepsis, isolation precautions, OSHA. And as always, I'm going to break everything down step by step and explain it in a way that's easy to understand, just like you're sitting in one of my classes. So if you find this video helpful, don't forget to like, subscribe, and turn on notifications so you don't miss any of the upcoming lessons and the video reviews. Also, if you're looking for additional support, check out passmawithdani.com. So, okay, let's go ahead and grab your notes, get comfortable, and let's dive in to infection control. So, infection control itself is one of the most important concepts for your exam, and not only just that, but also for real life. Understanding the chain of infection. So, if you understand this, infection control becomes way easier. Like everything just kind of starts clicking. So, here's the deal. Infections don't just happen randomly. They follow a step-by-step process, and we call this the chain of infection. So there are 6 total steps for an infection to spread. But here's the powerful part. If you break just one link in the chain of infection, you're going to stop infection from spreading. That's it. Game over for the pathogen. And if you're wondering, well, what's a pathogen? Anything that causes an infection. Think of a bacteria, think of a virus, right? Think of even fungi. So that's exactly what you guys are going to do as medical assistants every single day without even realizing it. Wash your hands, you're breaking the chain of infection. Wear your gloves, you're breaking the chain of infection. When you clean equipment, guess what? You're breaking the chain of infection. So instead of memorizing random rules, I want you to start thinking this. What part of the chain am I breaking right now? This is how the exam is going to test you. It's not just about memorizing, but also about application. So I'm going to tell you guys right now, this is going to show up on your exam, usually as a scenario where you have to figure out what step is being interrupted. So as we go through the 6 steps, don't just memorize them. I want you guys to actually picture how infection control spreads in real life and how do you stop it. That's how you're going to pass the questions every single time. So let's go ahead and dive in. So now that we know that this is important, let's go ahead and break down what the chain of infection actually looks like. So I want you guys to think of the chain of infection as a cycle. It keeps going over and over unless something stops it. So it starts with the infectious agent. I want you to think of this as being the germ that causes the disease. We also call this like the pathogen, right? Again, think of a bacteria, a virus, fungi. The germ needs somewhere to live. It needs somewhere to grow. This is what we call the reservoir. Now, the reservoir could be a person, it could be a surface, it can be soil, water, even animals. Now, next, the germ has to leave the body. This is what we call the portal of exit. Think of coughing, sneezing, blood, or even other bodily fluids. Now, from there, it spreads. That's the mode of transmission. This is how it travels from one place to another, like through air, by touch, or even contaminated objects. Then it enters a new person through the portal of entry. Think like the mouth, the nose, the eyes, or even broken skin. Finally, if the person is vulnerable, then they become the susceptible host. This means that they can get sick. Now, what I want you guys to remember is that all of us, every single person, is a susceptible host. We can all get sick. We can all contract a virus. We can all contract a bacterial infection. But there are certain individuals who are more at risk of being sick. Think of infants. They're still building and growing their immune systems. Think of geriatric patients. They're starting to lose their immunity, right? As we get older, our body systems start to change. And think of you guys who work in healthcare. You guys are surrounded by individuals that have bacterial infections, viral infections, day in and day out. So, working in healthcare, being immunocompromised, geriatric patients, again, infants, right? Pediatrics. This puts us more at risk, but any person can be a susceptible host. Now, here's the key. If we break even one step in the chain of infection, the infection actually stops. And this is exactly what we're going to focus on as we go through each part. So now that we understand how infections spread, let's talk about what actually matters, how to stop it. So this is what we call breaking the chain or breaking the cycle of infection. And good news, we don't have to stop every single step. If we interrupt just one part of the chain, we can prevent the infection from spreading. One of the biggest ways we do this is through something called medical asepsis. This just simply means keeping things clean. This includes using proper cleaning techniques, sanitizing, disinfecting, maintaining a clean environment, and making sure the equipment and surfaces are disinfected regularly. Another important part is following guidelines. This means sticking to infection control protocols that are set by the facility that you work for, as well as like local, state, and even federal regulations. So these rules are there for a reason to protect both the patients and you as being the healthcare worker. So then we have the patient education. Now, this is a ginormous part. As medical assistants, you guys are not just doing tasks, you're also teaching patients how to protect themselves. This includes educating them on proper hygiene, ways to stay healthy, and how to prevent the spread of disease. So when patients understand what to do, they actually become part of the solution. So remember, a clean environment, follow the rules, and also educate your patients. This is how we break the chain of infection. Now, diving through a little bit on the medical asepsis, right? We also call this the clean technique. Now, this is based on maintaining cleanliness and also preventing the spread of microorganisms in the medical environment. Now, I want you guys to remember when we talk about microorganisms or microbes, they're everywhere. Okay, they are all over the environment. They're on my desk, my laptop, my phone. They're all over your environment. Most of the time, microorganisms pose no risk, but there are times that they can be infectious or they can cause problems. So, the point of medical asepsis is to remove dirt and as many pathogens that we can. Okay, this is making sure that we break down the rooms. After every patient, making sure that we're cleaning every surface, the chair they sat in, the doorknob they touched, the blood pressure cuff that you placed on the patient's arm. Prevent cross contamination. And also remember to use PPE. That is our protective equipment, right? Now, when we talk about surgical asepsis is a bit different from medical asepsis. Medical asepsis, like again, includes disinfecting, it also includes sanitizing. With medical asepsis, think of washing your hands with soap and water. Think of using hand sanitizer in between patients. Okay? When we talk about medical asepsis gets rid of most of the microbes, most of the pathogens. But guess what? Not all of them. Surgical asepsis removes them all. all microorganisms, including viruses, including spores. And now I want us to take a deeper dive. So let's go ahead and look at medical asepsis. Now, I want you guys to think of medical asepsis as being your everyday infection control. This is what, again, what we call the clean technique. So, unlike the sterile technique, we're not trying to eliminate all microorganisms. We're really trying to reduce them and prevent them from spreading. So there is a big difference here. The goal here is pretty simple: reduce germs, prevent infection, and protect everybody that's involved. That includes you, your patient, and anybody else that's in the environment. Now, one of the biggest things with medical asepsis is understanding how infections spread in the first place, right? Now, if you understand how they spread, then you understand how to stop them. What is the number one way to do that? This is literally hand hygiene, guys. Washing your hands. And I'm going to keep repeating this because it's so important. Clean hands are going to be your first line of defense. Now, next is using PPE, personal protective equipment. So, depending upon the situation, you're using gloves, masks, gowns, or even eye protection to reduce your risk of exposure. You also want to make sure that you're using clean equipment and supplies. Anything that's considered to be reusable needs to be properly cleaned and disinfected before it's used again. So, speaking of clean, your environment matters. Surfaces, your equipment, guess what? Patient areas. All of that needs to be cleaned regularly to prevent the spread of microorganisms. Now, remember, microorganisms a lot of times cause no harm, but you guys have to keep in mind there are those that are actually harmful. Now, another important piece is proper handling and disposal. So, anything contaminated needs to be handled carefully and disposed of correctly, whether it's a sharps container or a biohazard bag. Now, let's talk about something that the test specifically likes to trip people up on: cleaning versus disinfecting. Now, cleaning, I want you guys to remember, removes dirt and most microorganisms. Disinfection goes a little bit further and it actually kills most microorganisms using chemicals. So they're not the same thing, but guess what? They do work together. And I want you guys to remember this: medical asepsis is part of your daily routine. You guys are going to do this day in and day out, in between patients, before patients, after patients. This is what you do every single time. So the small things: washing your hands, cleaning equipment, wearing your personal protective equipment. Those small habits actually do really make a big difference in preventing infection. So that's how you guys are not only going to protect your patient, but also protect yourself. So we're going to get into one of the most important parts of infection control: hand asepsis, or we also call this hand hygiene. Now, this is hands down the number one way infectious agents are spread in healthcare. It's through touch. So this means that everything you touch can either spread infection or can actually stop it. So when you see on the slide that proper hand hygiene is the most important aseptic procedure, I need you guys to really lock in. If you break the chain anywhere, this is the easiest place to do it. So now let's go ahead and talk about a few important details. Your nails matter more than people think. They should actually be kept short, no longer than 1/4 of an inch from your actual nail bed, okay, or past your fingertip. The reason for this being is that they harvest bacteria. You should also avoid things like nail polish or acrylic nails because guess what? Bacteria loves to hide there. Now, when it comes to washing your hands with soap and water, there are specific times when it's required. At the very start, okay? Make sure that you guys are also washing your hands, not only before you eat, but also after you eat. Before and after using the restroom is so important. Before you use the restroom to protect yourself, after using the restroom to protect your patient, before and after smoking or vaping, and anytime that your hands are actually visibly soiled. Now, if your hands look dirty, at this point, hand sanitizer is not going to be enough. You actually need to use soap and water. Now, alcohol-based hand sanitizer is still important, and it should contain at least 70% alcohol to be effective. you can actually sanitize your hands in between patients. Generally, we usually call this pumping in and pumping out. But if your hands, again, are visibly soiled after using the restroom, prior to eating, or if you're on your fifth time pumping with hand sanitizer, you need to wash with soap and water. Now, when it comes to washing with soap and water, you should wash your hands for a minimum of 20 seconds. And you guys need to remember that for the certification exam. And believe it or not, the same applies to hand sanitizer. You guys should be rubbing and working the hand sanitizer in your hands for also a minimum of 20 seconds. Okay? So I want you guys to remember sanitizer is great for routine use, but soap and water is necessary when there is a visible contamination. So I'm going to say the takeaway here is simple. Clean hands protect you. Not only do they protect you, but they also protect your patients and they stop the spread of infection. Now we're going to move to surgical asepsis, and this is where things actually do get more serious. So a little bit ago, we talked about medical asepsis. Again, that's also called the clean technique. And that means when we're talking about surgical asepsis here, this is called the sterile technique. This means we're trying not to just eliminate most, but to eliminate all microorganisms, including spores. So this is a much higher level of infection control. This is used anytime we're dealing with like invasive procedures, whether they are minor or major procedures. Anything that enters the body, anything that punctures through or cuts the body, we need to make sure that we are utilizing surgical asepsis. So think surgeries, injections into sterile areas, catheter insertions, biopsies, anything like that. So let's go ahead and talk about what that actually means in practice. So first, we have something called the sterile field. This is a designated area where only sterile items are placed. And once something is sterile, it has to stay sterile. If it gets contaminated, even just a little bit, guess what? It's no longer considered to be sterile. So one of the biggest rules you need to remember is if you're not sure if something is sterile, guess what? It's not. So just consider it to be contaminated. Now, there are some really important rules when working with the sterile field. You always have to keep it in sight. So what does this mean? You can never leave a sterile field unattended. If you leave it unattended, it is now considered contaminated. Because guess what? If you guys stepped away from it, you don't know what happened while you were gone. You always have to make sure that you keep the sterile field at waist level. Anything below your waist is now also considered to be contaminated or unclean. Now, another thing I want you guys to remember, especially for the certification exam, that you cannot place anything within the 1 inch border of the sterile field. So to kind of give you guys an example, and let me see if I can actually pull this up. Trying to see if it'll let me write on here. So let's say, and I'm writing on our slide, let's say this is our sterile field. When I say that you cannot put anything within that 1 inch border, it is the 1 inch border that goes around the sterile field. So if you have an instrument and it goes in that 1 inch border, guess what? This is now considered to be contaminated. You guys don't judge my drawings. I definitely am Picasso at stick figures. I want to be an artist so bad, but cannot draw to save my life. But anything that goes within that 1 inch border, again, is now considered to be contaminated. So no objects, no items can go within that 1 inch border. You guys need to make sure that you do remember that for the certification exam, okay? Do not use anything or do not place anything around the edges. Now, another big one is actually moisture. If something gets wet, guess what? It's contaminated. So if a sterile drape or a surface becomes damp, this is now no longer sterile. Now, I want us to talk about technique. Before performing any sterile procedure, you guys will perform a surgical hand scrub. Then you're going to put on sterile gloves and a sterile gown without contaminating them. Now, when it comes to opening sterile packages, this is also important. You guys always have to open them away from your body and only touch the outside. Another fact that you need to remember for the certification exam. When passing instruments, You want to avoid contaminating them, sometimes using a neutral zone instead of hand-to-hand passing. Here's the biggest takeaway. Medical asepsis reduces germs. Surgical asepsis actually eliminates all germs. Now, I also want you guys to remember you can never reach over a sterile field. If you put your arm over and reach over a sterile field to grab something, guess what? It now becomes contaminated. You do have to break down the field and start over. Okay, so never leave a sterile field unattended. Never reach over a sterile field. Never put any item within a 1-inch border of the sterile field. Okay, and make sure that your sterile field is at least at waist height. Okay, if sterility is broken, even for a second, guess what? You have to start over. When it comes to a sterile technique, there's no, well, it's kind of sterile, or I think it's sterile. It either is or it isn't. So you guys do have to be mindful of that. So kind of touching base back into hand hygiene. So soap and water is used when your hands are actually dirty. And we say like visibly soiled. This is very important, okay? If you see a C. diff question on the exam, you are automatically using soap and water. Hand sanitizer does not kill C. diff. Same after using the restroom. Always use soap and water. And you want to make sure that you wash your hands for a minimum of 20 seconds. Now, an exam trap that you guys may see. If the question mentions C. diff and gives hand sanitizer as an option, that answer is wrong. Eliminated out of the list. Again, with C. diff, you have to use soap and water. Now, we talk about alcohol-based hand rub. This is one of the most other situations that you guys can utilize alcohol-based hand rub, right? You are going to use it in between patient contacts. We call it pumping in, pumping out. You guys can also utilize hand sanitizer before and after gloves and when your hands are not visibly dirty. It's fast, it is effective, and you rub your hands until they're dry, a minimum of 20 seconds. Okay? Now, this part right here, you need to recognize this pattern. These are the key times that you guys are going to perform hand hygiene. Again, before touching a patient, before a clean or aseptic task, after any exposure to bodily fluids, after touching a patient, and after touching even the patient's surroundings. Now, you guys may see this actually show up on the exam in scenario-based questions. Now, a kind of high yield combo or a tip that I can give you guys, if you see a question with gloves and hand hygiene, just remember gloves do not replace hand hygiene. If you are wearing gloves, it does not mean that afterwards you do not have to wash your hands. You still will perform hand hygiene before and after donning and doffing your gloves. All right, now we're going to go ahead and talk about something that's very important for both the exam and even in real life. The universal and standard precautions. Now, first things first, this is not optional. OSHA does require that healthcare workers follow the rules, and they're based on guidelines from the CDC. The whole purpose is simple, to protect you and your patients from infection. Now, let's go ahead and break this down in a way that actually makes sense. When we talk about universal precautions, I want you guys to think of blood and certain high-risk bodily fluids. This includes things like blood, human tissue, semen, vaginal secretions, and even saliva. It also includes some of the more serious internal fluids like cerebral spinal fluid, synovial fluid, pleural fluid, and even other additional things like that. So basically, if it's a body fluid that can carry infection, especially if there's blood involved, you guys have to treat it like it's infection. There's no guessing. Now, standard precautions go a little bit of a step further. This is where you treat pretty much everything as being potentially infectious. Now, I want you guys to think of this as well. If you're asked a question on who is considered infectious, I want you to remember everyone. Every single person is considered to be infectious, okay? Think about this. Some people don't always present with symptoms, and we call them asymptomatic. A person can have the flu, right? They can be a carrier of the virus. and not even know that they have it because they don't present with symptoms. Another example is COVID. To give you guys a personal example, my son had COVID. He was a carrier. He had no symptoms whatsoever, but he was definitely infectious. Okay? You cannot always tell if a person's infectious. You can't look at a person and be like, oh, I know they have Hep B, or I know that person has Hep C. I can see that person over there has HIV. You cannot tell by outwardly glancing at a person. I don't care if they're there just for a consultation, if they're coming in for a medication refill, maybe just a blood pressure check. Treat every single person like they are infectious. Okay? Now, taking it back on a ways to remember this. When we talk about universal precautions, these are specific high risk fluid infections, right? Standard precautions is assuming that every single person could possibly be infectious. This is why things like hand hygiene, wearing personal protective equipment are so important because you don't always know what you're being exposed to. So don't ever try to play the guessing game. The biggest advice that I can give you guys is try to protect yourself every single time that you are dealing with patients. So now let's go ahead and bring this into real life. What this actually looks like in the workplace. At the end of the day, standard precautions come down to one mindset. You treat all bodily fluids as if they are potentially infectious. There are no exceptions to this rule. Again, do not try to guess. You don't assume. You protect yourself every single time. One of the biggest habits that you guys need to build is going to be hand hygiene. You should be washing your hands before and after every single patient interaction that you have. Not sometimes, every single time. Remember, your hands are the number one way that infection is going to spread. Next is PPE, right? Personal protective equipment. If there's any chance that you're coming in contact with blood, bodily fluids, specimens, remember that you need to be wearing the appropriate protection, whether it's gloves, a mask, gowns, eye protection. Always protect yourself. Another thing that people forget is how often we touch our faces without even thinking about it. Touching your eyes, your nose, your mouth in a clinical setting is going to be one of the easiest ways to actually infect yourself. And lastly, I want you guys to remember to protect yourself physically, even things like wearing proper shoes to protect your feet from spills or exposures. So, really, this is just about habits, small, consistent habits that are going to protect you, your patients, and guess what? Every single person around you. In healthcare, you guys aren't just caring for others, you also have to remember to protect yourself too. So now we're going to go ahead and dive into OSHA. And I'm going to be real with you guys. This is one of the topics that sounds boring, but it is very important. OSHA created regulations for infection control back in 1991 called the Bloodborne Pathogen Standard. The whole purpose of this is simple to protect the healthcare workers like you, but also to protect the patients from exposure to infections. Now, one of the biggest things that OSHA focuses on is how we handle and how we dispose of potentially infectious material. So now we're talking about things like blood, body fluids, human tissue, cultures, and even used supplies like gloves or anything that has been contaminated. All of that has to be handled properly and placed in biohazard containers. There are no shortcuts to this. Now let's go ahead and talk about some things that the test loves. Sharps, okay? Now I want you guys to remember sharps are considered anything that punctures through or breaks through the patient's skin. Think of needles, lancets, um, disposable dermablades. Anything that punctures the skin is considered to be a sharp. And these are dangerous because they can expose you to serious infections like hepatitis or even HIV. So there's going to be very strict rules here. You never bend, break, or recap a needle ever. If on the certification test they ask you about recapping a needle, eliminate it, okay? Out of the question. We never recap needles. So I want you guys to remember this. Once the needle is used, it goes straight into the sharps container. No playing around. And a sharps container is a punctured proof container that is specifically meant for sharp objects. Another thing to remember is we do not fill the sharps container more than 3/4 of the way full. Now, this picture may not show, but most of our sharps containers actually have a fill line to show you where the 3/4 marker will be. The reason that we don't put any sharp objects past the fill line is because needles can start poking out of the container. This puts you at risk from obtaining a sharp injury. So remember, do not fill more than 3/4 of the way full. Again, majority of our sharps containers will have fill lines, or all of them pretty much do, so that you guys know where to stop. Okay? Now, these rules are basically the minimum standard in every single healthcare facility. We have to follow these to keep you safe and to keep your patients safe. And one last thing I want you guys to remember. States can also have their own specific rules too. So please just keep in mind that you guys are specifically kind of following your own state guidelines. Whether you're working, you guys need to make sure you understand not just the general OSHA guidelines, but also what your state requires. These rules basically exist to protect you. So please take them seriously and follow them every single time. So now we're going to dive into something very serious. We're talking about sharps and safety. So I want us to talk about safe injection practices, and again, diving a little bit deeper into sharp safety. This is not just about the exam. This is about protecting yourself from life-changing infections. So let's go ahead and start with the basics. Anytime you're using a needle or anything that can puncture the skin, you need to be thinking safety first. And here's the key point that I need you guys to remember. Anything, and I'll say it again, I sound like a broken record. Anything that punctures the skin is considered to be a sharp. We're not just talking about needles. We're talking about lancets, disposable scalpels, razors, suture needles, and even things like glass blood collection tubes if they can break and cut you. All of these go into a sharps container, no exceptions. Now, I want us to talk about safe injection practices. First, once a needle is used, it goes straight into the sharps container, not on the tray, not in your pocket, not, oh, I'm going to throw this away later, immediately. And even if it's unused, if there is any doubt, if you're not sure, any doubt, throw it out. Now, another big one is never reuse a syringe or a needle. One patient, one time, done. We do not double stick. Reusing equipment is a fast way to spread infection. Always use the aseptic technique. This means clean your hands, clean the equipment, and follow standard precautions every single time. Don't forget to clean the top of the medication vials before inserting a needle. That's an easy step that people sometimes skip, but guess what? This does matter. Now, I want us to go ahead and circle back to the sharp safety again, because this, I have to be honest, it's where people mess up. Again, I keep saying I sound like a broken record, but there are certain things that I want you guys to hold on to. Never bend, never break, never recap a needle. I don't care how fast paced things get, don't do it. That's how needle stick injuries actually happen. Needle stick injuries can expose you to serious infections, HIV, hepatitis B, hepatitis C. The rule is simple. Use it once, dispose of it immediately, and don't touch it again. Bottom line, this isn't just going to be a skill for you guys. It's going to be a habit that you guys are going to perform day in and day out. And the better that your habits are, guess what? The safer you and your patients are going to be. Now we're going to go ahead and get into something called engineering controls. And don't let the name fool you. This is actually pretty simple. So they're physical safety tools and systems that are put into place to protect you from exposure. So instead of relying on you to be careful, these controls are designated to reduce the risk automatically. Now, OSHA actually requires these, especially when it comes to handling sharps. So let's go ahead and talk about the big rules that you guys are going to need to know. First, never recap, reuse, or bend a needle. Again, I don't care if it's the same patient. I don't care if you're in a rush. Don't do it. That's one of the fastest ways that can cause an actual needle stick injury. Once a sharp is used, again, it goes straight into the sharps container. Immediately, no delay. And those containers have to be OSHA approved. They have to be puncture proof and leak proof. You also need to make sure that the container stays upright. You can't lay it on its side, you can't lay it flat down, and you cannot overfill it. Once it hits the fill line, again, usually about 3/4 full, it is done. Do not try to push more in and never reach into a sharps container ever. What's in there is so dangerous, you guys, and you don't go digging around. Remember, you have scalpels, dermablades, needles, razors. You are setting yourself up for a needle stick injury if you try to reach in there. Now let's go ahead and talk about non-sharp contaminated objects. Things like gauze, plastic tubes, anything that could be heavily contaminated with blood or bodily fluids. This then goes into the biohazard bag. Now these are the red bags that you guys see over to the right-hand side of the screen. They're specifically designed to hold infectious waste. Here's the catch. You don't throw anything in there that can puncture or tear the bag. Remember, anything that punctures goes into the sharps container. Any object like gauze or item like gauze, any type of dressing, gloves that are contaminated, those go into the biohazard bag. Sharps never do, okay? Sharps only go into the sharps container. So keep this in your head, guys. Sharps, sharp container. Soft contain soft contaminated items go into the biohazard bag. Okay? This distinction is huge for your certification exam. All right. Now, we're going to talk about what your employer is responsible for because safety is not just on you. Your workplace actually has a legal responsibility to protect you from exposure to bloodborne pathogens. This, guys, is not optional. It is required by OSHA. So one of the first things that you guys have to do is create something called an exposure control plan. This is something they have to do. This is basically a written plan that outlines what to do if an exposure happens. So this includes emergency procedures, steps to follow, and even keeping a record of any exposure incidents. So if something happens, there's already a system in place. You're not just guessing what to do. Now, another one is training. Your employer has to provide training to all employees and document that training. So if you've ever sat through those infection control modules or in services, guys, guess what? This is why. They also have to provide PPE, your gloves, your masks, your gowns, your eye protection. You should never walk into a facility and be told that you have to buy your own gowns, your own mask. That is against OSHA. Okay? Your employer has to give you the tools to stay safe. Another important point is the Hep B vaccine, hepatitis B. You guys in healthcare are at risk, okay? Your employer will offer the Hep B vaccine at no cost to you. This means they cannot charge you out of pocket, nor can they charge your own personal private insurance. It is offered free to you guys. So if you're working in a setting where exposure is possible, this protection will be available to you. And then we have the Needle Stick and Safety Prevention Act. This focuses on reducing injuries from sharps. So this includes using safer devices, tracking sharp injuries, and putting systems into place to prevent them. So the big takeaway here is that your employer also has responsibilities. And guess what? You as the employee, guys, you have rights. So you have the right to a safe work environment. And if something doesn't feel safe, please speak up. OSHA is there to protect you as being the employee. At the end of the day, your safety matters just as much as your patients. So now we're going to level up a bit. We already talked about standard precautions, and that's what we use for every single patient. But now we're going to go ahead and talk about transmission-based precautions, which are an additional level of protection. So these are used when we know or suspect that a patient has an infection or a disease. So this is basically more targeted. There are three main types that you need to know, okay? And you have to know the differences. So let's go ahead and break them down. First, We have what we call contact precautions. This is for infections that spread through direct or indirect contact. So this could be touching the patient or touching something the patient touched, like equipment or even surfaces. Examples you'll see on the exam include MRSA, C. diff, and even scabies. If you're wondering what scabies are, guys, these are mites that actually burrow under the skin to lay their eggs. So with contact precautions, you guys are usually going to wear gloves and a gown, okay? So now let's go ahead and talk about droplet precautions. This is for infections that spread through respiratory droplets, like when someone coughs or when they sneeze. These droplets don't travel very far, usually about maybe 3 to 6 feet. So if you're within distance, you guys are going to need protection. Examples include the flu, measles, whooping cough, and even meningitis. With droplet precautions, you guys will wear a surgical mask, not an N95 respirator. You just need a surgical mask. And you want to make sure to try to keep your distance when possible. Now we have what we call airborne precautions. These infections spread through very tiny particles that can actually stay in the air for long periods of time. So now we're talking about things like TB, tuberculosis, measles, and even chickenpox. A lot of people don't know that chickenpox are actually airborne. Yes, they can be from direct contact, but it is airborne. Now, with airborne precautions, you guys will need an N95 respirator. A surgical mask will not cut it, okay? The patient is usually going to be placed in an isolation room. So here's the easiest way to remember this. Contact is touch. Droplet is close range. Think of 3 to 6 feet. Droplets require a surgical mask, and airborne stays in the air. You will need an N95 respirator. No matter what precautions you guys are using, hand hygiene again is always going to be required. That's something that's never going to change. So the key takeaway here is different infections spread in different ways. Your job is going to be to match the right protection to the situation. This is so crucial, not only for real practice, but again, for your actual certification exam. Now we're going to get into the autoclave. And I need you guys to really pay attention here because this is a high yield topic for the exam. An autoclave is the gold standard for sterilization in healthcare. And when we say sterilization, we're talking about destroying all microorganisms, including spores. That's what makes this different from cleaning or disinfecting. So, how does this work? The autoclave uses three things together: steam, heat, and pressure. Not just one, all three. This combination is what's going to allow to fully penetrate materials and kill all microorganisms completely. Now let's go ahead and walk through the process so it actually makes sense. The first step is going to be to remove the air from the chamber. This is important because steam needs to fully surround the item to be effective. So next, the steam actually enters the chamber and it does begin to circulate. So then we have the exposure phase. This is when the autoclave sterilization happens. The autoclave maintains a specific temperature, a specific pressure, and time to kill all microorganisms, After that, the steam is going to be released and then the drying phase begins. So at this part, it's very important. Items must be completely dry before you remove them from the autoclave. If they actually do come out wet, guess what? They're actually considered to be contaminated. Now let's go ahead and talk about the temperature, the pressure, and the time, because this is where the exam likes to test you. For a standard gravity displacement autoclave, the temperature is a minimum of 250 degrees. Okay, I want you guys to remember that. You guys aren't going to have to remember every single number perfectly, but you will have to recognize ranges and understand the concept. For example, a pre-vacuum autoclave, the temperature is going to be a little bit higher. It's going to be around 270 degrees Fahrenheit, and the time for processing is a bit shorter. Now, I want us to go ahead and talk about water, okay? This is something that students actually often overlook, but it's going to be testable. You guys will be asked what kind of solution is put in an autoclave, or what kind of solution is utilized to sterilize instruments. It's not bleach. It's not some fancy dancy chemical. It is only distilled water, guys. Okay. You need to remember that for the exam. Distilled water. Okay. Now, they may ask you a question. You pull the instruments out of the autoclave and you see spots on them. What could have caused this? If you guys see spots on the autoclave or on the instruments, that's what we call mineral deposits. The actual reason that mineral deposits show up is because someone actually used tap water instead of using the distilled water. And over time, tap water will damage the machine. So, minimum temp 250 degrees Fahrenheit for the autoclave. What type of solution is put in there? It is going to be distilled water. You guys will need to remember that for the exam. Now, this is another high yield topic on the exam. We're going to talk about donning and doffing. Now, donning means to put on. And I actually want to show you guys a quick, easy trick to remember this. If you look at the word, and let me get my little pen up and running. If you guys look at the word don, okay, or donning, take away the D, and what do you have left? You have on. If you guys see the term don, that means to put on your PPE equipment, put on your gown, put on your mask, put on your eye protection, put on your gloves. If you guys see the term doff, okay, I'm circling it with my pen, take away the D. What do you have? Off. Doff is to take off. Take off your gloves. Take off the eye protection. Take off the gown and take off your mask. Okay? Don is to put on. Doff is to take off. All right, now we're looking at CCMA mock questions. Let's go ahead and look at this one. A patient is admitted to the clinic with a new diagnosis of active pulmonary tuberculosis. Which type of transmission-based precaution is most appropriate for the patient? Would it be A, contact precautions, wear gloves and gowns when entering the room, B, droplet precautions, wear a surgical mask within 3 feet of the patient, C, airborne precautions, place the patient in a negative pressure room and wear an N95 respirator? Or would the answer be D, standard precautions? Use hand hygiene and PPE only if contact with bodily fluids is expected. Now take a second, pause if you need to, and think about your answer. Now, the correct answer for this is actually going to be C, okay? Tuberculosis is spread through tiny droplets that actually can remain suspended in the air for long periods of time, and they can actually travel through air currents. So a patient that is positive for TB needs to be placed in a negative pressure airborne infection isolation room, and staff need to wear N95 respirators to prevent inhalation of infected particles. Okay, so you guys need to remember that. Again, airborne precautions for tuberculosis, an N95 respirator is needed. Now, we're going to go ahead and look at some key terms for infection control. Now, biohazard. Biohazard, this is a biological or chemical substance that is dangerous to human beings and the environment. When you guys hear OSHA, OSHA stands for Occupational Safety and Health Administration. I want you guys to remember, OSHA protects you and me as being the employee. Now the CDC, this stands for Centers for Disease Control. CDC, they're the organization that provides safety guidelines for medical facilities and offices. HIV, this is the human immunodeficiency virus. This is a virus that invades and inactivates your helper T cells. Now, just to kind of touch base on HIV, our thymus is located posterior to your sternum. Your sternum is that flat bone that sits in the middle of your chest. Now, your thymus is so important because it houses your T and your B cells. Your T cells and B cells are so important because they are kind of the building blocks of your body's immunity. Think of your T cells as being your body's warriors. They are banding together and they are fighting and going to war for you. They're the front linemen when an infection invades. Your B cells, they are making antibodies to protect you against that foreign invader. So if someone has HIV, they are immunocompromised because HIV targets the T cells and the B cells. This means they don't have warriors. They don't have the front linemen fighting for them. And then again, medical asepsis, we also call it the clean technique. This is the practice designated to reduce the number of pathogens to break the chain of infection. Surgical asepsis, remember this is the complete removal of all microorganisms, including viruses and spores. Sharps container, this is a puncture-proof container that's designated to safely dispose of needles, scalpels, anything that punctures through or breaks a patient's skin is considered to be a sharp. Then we have standard precautions. This is basic infection control practices that are used with all patients. Again, remember, every patient is considered to be infectious, right? Even if they don't outwardly present with symptoms, we treat every patient like they're infected. Then we have the chain of infection. Remember, there are 6 links in the chain. These events contribute to the spread of infection. Think of the infectious agent, any pathogen, right? A bacteria, virus, fungi. Then we have the reservoir. This can be a surface, a body of water, soil, animals. The portal of exit is how the infectious agent gets out. The mode of transmission is how it transmits. The portal of entry is how it gets into the susceptible host. We are all considered to be susceptible hosts, okay? Anyone can be. But remember, they have more those that are more at risk, infants, elderly, and of course, healthcare workers, as well as those who are immunocompromised. And then PPE. Guys, remember PPE stands for personal protective equipment. Think of your goggles, think of your mask, your gown, your gloves. All of those are considered personal protective equipment. All right, let's go ahead and do a practice question. So we have a medical assistant is disinfecting the exam room surfaces and cleaning reusable blood pressure cuffs between patients. What type of asepsis is being practiced? A, surgical asepsis. B, the sterile technique. C, medical asepsis. Or D, airborne isolation. Again, pause it again if you need to. Answer the question before moving on. Now, if you said C, then you are correct. Okay? Medical asepsis involves using cleaning and disinfecting to reduce the number of pathogens on inanimate objects, surfaces, and equipments. Disinfecting the exam room surfaces and cleaning equipment between patients is considered medical asepsis. Also, washing your hands or using hand sanitizer. All right, you guys ready for another question? A medical assistant is collecting a specimen of blood from a patient. Which type of precautions should be used? Would it be A, standard precautions, B, contact precautions, C, airborne precautions, or D, droplet precautions? Pause the video if you need to and make sure that you guys do choose your answer before moving on. All right, if you said A, then you are correct. Standard precautions are used with all patients at all times, regardless of their diagnosis or their suspected infection. Okay, A is standard precautions. All right, next question. A patient has been diagnosed with C. diff and is admitted to the facility. Which type of transmission-based precaution should the medical assistant follow? Would it be A, standard precautions, B, droplet precautions, C, contact precautions, or D, airborne precautions? Again, pause if you need to think about your answer and then resume the video. If you said C, then you are correct. C. diff is spread by fecal to oral route through contact with contaminated hands, surfaces, objects. Contact precautions, I want you guys to remember, help prevent transmission. Use gloves and gowns when entering the room and make sure that you are performing proper hand hygiene. All right, let's go for another practice question. A medical assistant performs proper hand hygiene between patients. Which link in the chain of infection is being broken? A, the reservoir, B, the mode of transmission, C, the susceptible host, or D, the portal of exit. Now pause the video and make sure that you guys do answer the question before moving on. If you said B, that is correct. Proper hand hygiene prevents the spread of infectious agents from one person to another. This actually breaks the mode of transmission in our chain of infection. All right, guys, I want to go ahead and kind of bring everything together real quick. So at this point, you guys really don't need more info. You just need to make sure that you're not missing easy points on your exam. So first thing, standard precautions. Just remember that this applies to every single patient every single time. If you ever see a question trying to make you pick and choose, don't fall for it. Next is going to be your precaution types. Make sure that you guys can recognize the difference between airborne, droplet, and contact precautions. Also, what PPE goes with each one. So remember, droplet precautions are going to be a surgical mask, right? When we talk about airborne, we are using an N95 respirator. A lot of questions that you guys are going to run across aren't going to ask you directly. They're going to be scenario based. They're going to just describe a situation and kind of expect you to figure it out. Now we talk about the sequence of PPE. Remember that donning means to put on. To don is to put on. The order of sequence is going to be gown, mask, eyes, and then gloves. Doff, D-O-F-F, is to take off. Now you're going to reverse the order. You're going to remove in the order of gloves first. So it's going to be gloves, eyes, mask, then gown. If you remember nothing else, remember gloves will come off first, okay? Now let's go ahead and talk mistakes because this is where points are going to be lost. Recapping needles, never do it. It's always going to be wrong. Skipping hand hygiene between steps, wrong. Just because you're wearing gloves doesn't mean that you guys do not that you guys do not clean your hands. Confusing medical and surgical asepsis. Remember clean versus sterile, okay? Medical asepsis is what we call the clean technique. Surgical asepsis is where we have sterilization. Now, using the wrong PPE for the situation, this can tie back to knowing your precaution types. Remember never to overfill a sharps container. This is going to be a safety issue, and the exam is going to expect you to know better. And don't forget that no instruments or items on a sterile field are placed within that 1-inch border of the field. This is going to come up a lot more than you guys think. If you understand these concepts, you guys are already going to be ahead. Don't overthink the questions. Look for keywords. Trust what you know. You guys got this. I hope you guys enjoyed today's review. We're going to start doing more actual lesson reviews on top of NHA, or not just NHA, but CCMA general exam questions overall. If there's something or a specific topic area that you guys would like to cover, please don't hesitate to reach out and let me know. If you guys did find this beneficial, please go ahead, like, subscribe, and put it in the comments and comment on what you guys would like to have a review on as well. Also, check out passamawithdani.com. For those of you guys that are getting ready to test, approaching testing, need additional review, you guys are going to find module breakdowns with notes, slides, as well as flashcards and practice quizzes for each section or subject area covered. On top of that, you guys are going to get cheat sheets, a bunch of different resources, as well as 10 100 question mock exams that all have rationales. And you also do have a 200 question final that also has rationales as well. All of the mock exams and the quizzes are limited attempts. So make sure that you guys do check out passamawithdani.com. Again, please like, subscribe. And don't forget to tell me what you guys would like to see next. It's been great. I hope you guys have an amazing rest of your day. And I know that you guys are going to do absolutely amazing. on your certification exam. I cannot wait to see all of the great things that you guys do. Make sure that you guys don't get overwhelmed. Keep your head up and just know that you do have somebody rooting for you on the sidelines with their invisible pom poms. Have a great day and see you guys tomorrow.